Chair recognizes the lady from Story, Representative Heddens, for opening remarks on Amendment H1096.
Thank you, Mr. Speaker, and good afternoon, ladies and gentlemen of the House. Well, I don't know about you all, but I certainly was surprised on Friday when we found out that United Healthcare was leaving Iowa as a managed care provider. Director Foxhoven and the governor said the main reason that United Healthcare were leaving was because they didn't want to be penalized for maintaining quality goals. United Healthcare came out with a press release today saying, it really came down to the inability to find a path forward for sustainable funding. But you know what? I really don't care. I think that Medicaid privatization has forgotten about the people that it serves in the state of Iowa. And I'm angry. I am angry at what has occurred. Reduction, denial, and determination are the top 3 issues that the Managed Care Ombudsman's Office has received in complaints since managed care was instituted in the state of Iowa. Reduction, denial, and termination. Families not receiving the support services they need, and providers not being paid timely or adequately or correctly, whichever word you want to describe it. Do we want sustainability and do we want accountability in our managed care program? Absolutely. I'm not disagreeing with that at all. But I want to make sure that people are getting the services that they need to maintain their level of independence. I was at a forum on Saturday, and just before my forum started, I received a text message from a mom who has a son who is on one of the Medicaid waivers, lives independently, but gets some support services. And her text message to me was, he is freaking out, and so am I. I've received emails from family members saying, what are we going to do? It's another change for them. Yes, we've been through this change before. AmeriHealth left the state last year. But you have to ask yourself, why? Why did they leave? Have we learned nothing? Because we have another big managed care company that's leaving the state of Iowa. Are we considering the ramifications of disruption to the people that are served under this program? Are we? We're just disrupting too many lives. Families and individuals are tired and they're stressed out. For some families, this is going to be their 3rd managed care company. Some started out with WellCare. Then when WellCare left the state, they chose AmeriHealth. Well, AmeriHealth left the state. Then they went on to United Healthcare. And now United's leaving the state. They've had 4, 5, 6 case managers. And case management is an integral part of delivering services. It is to ensure that people receive the level of supports that they need to live as independently as possible. Can you do that if you're on your 6th case manager in 3 years? I don't think so. Families are tired. And actually, quite honestly, they're not just tired, they are outraged. They are outraged that this is occurring again. I have received so many emails from both families and providers. I have this one email from a family member who says, my 40-year-old son has an intellectual developmental disability. He was assigned to United Healthcare when AmeriHealth abruptly left in 2017. Now that UHC, United Healthcare, will be leaving Iowa's managed care program, my son and others with intellectual disabilities are again facing uncertainties and likely disruption to their services. Transitions for individuals like my son are always difficult, and this one will be no different, regardless of what Secretary Foxhoven says or intends. It's time to acknowledge that Iowa's managed care program is not working for the most vulnerable population, and to direct officials in the Department of Human Services to implement a transition plan that will put the management of long-term services and supports provided through Medicaid home and community-based waivers back under the management of the state and counties. This will ensure greater oversight and control by the legislature and to better ensure the health, safety, and well-being of Medicaid recipients like my son. This one came from a provider who said, "It sadly feels if all I do since the implementation of managed care is complain. And please know that is not the person or the provider I want to be. Learning yesterday about United leaving the state leaves me unable to even absorb what this means for providers in Iowa, and specifically in the intellectual disabilities ID waiver, where the vast majority, more than 95%, are served by United. My mind is reeling about how we, already without sustainable funding, will now integrate with a third managed care company with all the billing systems, rules, and regulations, systems about which no information is known, transfer the required information about people we serve for United into a new MCO system in a short period of time, and help families select yet another MCO, especially since Iowa Total Care does not have their provider list published so that families know which physicians and our providers they will be able to get their services through." That is unconscionable to me, that families are having to deal with this again. And what have we done in this body to address it? What has the governor done to address it? I have not seen one bill, not one bill, come from her office to address this mess. She said at the state of state that managed care is here to stay. She said there have been some bumps in the road and that we need to do some fixes. Well, where are the fixes? I haven't seen one come from her office. But I will tell you one thing, Democrats have been providing some solutions. We have put some out there and nothing has been up for discussion. And why is that? Has the legislature turned a deaf ear to our constituents? I know I've been at forums where some of my colleagues have said, you know what, I don't hear from constituents anymore. I don't hear from providers anymore. Well, you know what? I do. I do. And they call me and say, you know what? My representative, they don't listen to me anymore. They don't call me anymore. They don't call me back. They don't respond to me. So I'm calling you, Lisa, because I'm hoping that you can help find some resolution here. Why aren't you? Shame on you if that's been what you've been doing, because we need to be doing something now. We need to do something today to address this. You're looking at 425,000 Iowans that are going to be disrupted again. And when AmeriHealth left the state, United took the majority of those individuals because AmeriGroup at that time did not want that population. They said, we're not able to sustain that high-level LTSS population, so United took them on. Well, what's going to happen now? Has anything changed for AmeriGroup? Iowa Total Care that's coming on, are they prepared to take on a larger percentage of individuals than what they thought of? What more are families going to go through? What is going to happen? What is it going to take in the state for this body, for this governor, to address the failings of privatization of Medicaid? Last year, I stood up here and did a point of personal privilege about a woman that I know whose daughter had unexpectedly passed away. And as I was at the funeral in the greeting line to give my condolences to her, the mom pulled me aside and said, you know what, Lisa, I hate to say this, but at least now I don't have to deal with those MCOs anymore. How awful for a parent to even say that. That has haunted me since she has said that. I understand her. I understand everything that she's saying. I too am a parent. I have a child with an intellectual disability who receives services through Medicaid, so I get it. I get the fear that she has and the pain that she has. I hear that from the other families, and yet we have done nothing. So today I'm bringing forth something for us to do. I am saying that we need to pull the LTSS, that long-term services and support population, out of managed care, put it back in fee-for-service, and say, you know what, let's start with those folks there, keep the rest in the rest of the system, and try to put some stability back in. Because we have an unstable system if not just one managed care company, but two now are leaving the state. 2 are leaving the state within a year's time frame. And what are you telling your constituents back home? Sorry. Hope this next one's better for you. Good luck. Go talk to Lisa. Don't talk to me. What are you telling them? Shame on us if we don't do anything. Shame on us.